Live from ABC 7, this is News at 6.
Well, today is Bra Day in your Healthy Living or Breast Reconstruction Awareness Day. So Bra Day is supported by the American Society of Plastic Surgeons to raise awareness for reconstructive options available to women going through breast cancer, the journey there.
Yeah, have a listen to this, everybody. Dr. Kiran Gill joining us live in studio right now. She's a plastic and reconstructive surgeon in Naples. Thank you for joining us, Dr. Gill.
Thank you for having
appreciate
me.
your time.
Yeah, thank you for having me, of course.
So you noticed in your practice that a lot of people that are going through breast cancer don't realize they have options when it comes to reconstructive surgery.
This is correct, and it's very interesting because a lot of women, we're very aware of breast cancer, which is very important. It's a prevalent disease, but many women that come to see me don't understand reconstruction at all. So part of this awareness campaign is to educate the public about your reconstructive options. So not only is it my job to do that, but make it more aware so people can seek a plastic surgeon to get breast reconstruction.
Yeah.
And now they have new technology options here in Southwest Florida, specifically at your facility. Can you kind of tell us a little bit about that?
Correct. I do mostly implant-based surgery, and something that's very important is assessing the blood flow to the skin flaps after the mastectomy is done. And so we have a new technology called PhotonView that basically interoperatively allows me to assess the blood flow and allows me to be more aggressive with the reconstruction. So sometimes even providing a one-stage reconstruction, so putting an implant in right away instead of having to go through that whole tissue expander process.
Wow. And you're one of the first in the country to use this, right?
Yeah, it's a new technology. I was very fortunate to be one of the first surgeons able to use it, especially here in Southwest Florida. So it gives women an option to be more aggressive with their reconstruction and sort of be done with it after the first surgery, which is really nice.
What does it mean for women, such as your patients, to have that option? What does it do to them emotionally, knowing that they have hope?
Of course. So basically, instead of having the mastectomy and me putting a tissue expander in, they're done with the one surgery. So if I assess the blood flow and I think that the skin can accept an implant, when they wake up, they have a reconstructed breast, which I think makes a big difference when you wake up and you have those breast mounds there. And every woman is different, but you know, it really makes a difference to most women.
Yeah, a lot of times women going through this, or men even, it's a self-confidence thing, and when you wake up from that surgery, having that there, I'm sure makes a huge impact.
Of course, and I love being part of the team that treats breast cancer patients, and I like to make them feel whole again and reconstruct them, and it really does make a difference.
Yeah. Talk a little bit about the options that women have, the types of implants, things like that.
Sure. So in breast reconstruction, there's really two options to reconstruct a patient's breast. One is using your own body tissue, so your tummy or your back, to sort of transplant tissue. And the second option is using implants. And most of us now are using implants. Over the last 10 to 15 years, there's been so much advancement in the technology of breast implants. They feel more natural. The gel is more cohesive, so more of a gummy bear implant, so that gel doesn't leak out like the implants from the early 80s. So more naturally feeling, multiple different shapes, shaped implants, round implants. So women have a lot of options, and it's really a tailored approach to their reconstruction. We're making it more aesthetic.
And how important is it to have a Bra Day, a breast reconstruction awareness day?
Well, if you look at the women that are having mastectomies, only 50% are being offered reconstruction in the country. So I think it's really important to increase awareness. And one of the biggest things I think is important for women to realize is that insurance covers it. It's a federal mandate. In 1998, the Women's Health and Cancer Act said that any insurer that covers breast cancer has to cover reconstruction. So I have women that come and talk to me and they say, well, after we have the big consult, will insurance cover it? And I said, yes. They'll even cover the opposite breast to make things look more even. So it's an option. Not everyone has to do it, but it's your option. Insurance will cover it. So that's why we do it.
Yeah. All right. Thank you so much.
Thank you for having me. Thank you for having me.
Anytime. Good conversation for sure.